Hello, good evening. Time's come round. Time has come round quickly, hasn't it? Turn my phone off before I get any embarrassing calls. Hello and welcome. It's got my mic in view. My man Mike. Got some questions to answer tonight. They call me JJ Stiano, plastic surgeon extraordinaire, and I will be answering your questions here and now live. We got some kind people who've asked me some questions in a preordained fashion, which I will attempt to answer, and I will also attempt to answer live before your eyes any questions that might come up as we go. So feel free to comment and share. Feel free to comment and share. If you have any questions, then you can please ask them here and now. In case you're wondering where we are, we're at Tuesday night at 7 p.m. I think, are we? Yeah. So without further ado, if you've got any questions, don't be shy. Do feel free to ask them. If you want to be anonymous, then you can email them to me or direct message me. Previously. So question number one question, which is going to come up on the screen anytime now. Oh yeah, there it is. Having a breast reduction if you've already had a breast reduction in the past. Right, okay, good question. Thank you very much for that question. In fact, thank you for all of these questions because they're all good questions, but this is a particularly good question because it's from a patient of mine who's had a breast reduction, who's delighted, very pleased with the breast reduction, and I'm very pleased about that, but she still feels her breasts are too big. And this is not uncommon. People having breast reduction saying, yeah, no, I'm really good, but you know what, I wish it was a bit smaller. I guess it's a bit like people having breast augmentation saying they wish it got a bit bigger. Maybe it's not like that at all, actually. No, it's not really like that, but it's like that in terms of people not being 100% happy with the size that you make them. It's one of the not the perks of the job. What's the opposite of perk? One of the problems or one of the issues with the job is, number one, making people happy, because always trying to make what you have in your mind to be what the patient has in their mind. I was just doing a case just now with one of my colleagues, and we thought it looked really good at the end of the operation, and really it doesn't really matter what we think, it matters what the patient thinks. So that is one of the challenges of aesthetic surgery, of cosmetic surgery, when you're doing things for aesthetic reasons. For it is very much in the eye of the beholder, or well, the beholder being the person looking in the mirror. I guess that still works. Yeah. Okay. So where was I? So that the question about people having a breast reduction and wanting another breast reduction, that's the question. Yes. Short answer, yes, you can have another breast reduction. But a couple of riders. I'm going to put a couple of riders on there. First rider, something that I always try and tell people preoperatively with regards to size when you're doing a breast reduction. The bigger the breasts are before you start, the bigger they will be when you finish, because when you do a breast reduction, you have to keep a stalk of tissue. We call it a pedicle. A pedicle being like a stalk of tissue going towards the nipple. Now you can do a free nipple graft where you take the nipple off and put the nipple back on as a graft. I don't like doing that. I don't think it's a very nice, personally, I don't think it's a very nice way of doing it. We always get problems with numbness in the nipple. You get lack of projection of the nipple, and that doesn't stick out very much. So there are issues with it. It's only, in my hands, it's only for people with very, very big breasts. So if you do a free nipple graft where you take the nipple off and put it back on again, then you can make them any size you want, really. You can, that's how you make women into men, really. So you can do it that way. But in my view, it is far better to keep the nipple alive rather than taking it off and putting it back as a graft. So that means keeping a stalk of tissue going to the nipple. And the bigger your breasts are, the lower they are. Is the nipple areolar complex transposition. It's how far the nipple areolar complex moves is the issue. So the lower they are and the further they have to move, the longer the stalk will be. And when you do the breast reduction, that stalk will carry with it a certain amount of bulk and a certain amount of volume. That's why people who are very big, we can't make them really, really small, because you would jeopardize the vascularity of the nipple. You would just jeopardize the blood supply to the nipple. You can lose the nipple when you do a breast reduction. You can also just jeopardize the nerve supply to the nipple, so the sensation can be altered. The milk ducts can be interrupted, so you might not be able to breastfeed. So you try and leave as much of the normal structures going to the nipple as you can, but the longer it is, the more of those structures you're going to be dividing. And so you want to make it as bulky as possible to keep all the nerve supply, the blood supply, and the milk ducts going to the nipple, but that makes the breast bigger. Ooh. Ooh. Sorry about that. So that's the reason why they're often a bit big. People who, that's why I try and make it clear to people preoperatively that they will be a certain size. That's number 1 point. So I think I've got 3 points on this question. Number 2 point I would say is, yes, you can have another breast reduction. If you have another breast reduction, you've already had a breast reduction or you've had a breast lift, the surgeon needs to know how they did the original surgery. Now, obviously, I did the original surgery in this patient, and if she wants me to do it again, we're all happy about that because I know what I did. But if she went to another surgeon, or if someone came to me having had a breast reduction and wants another breast reduction, I would need to ideally get the operation note from the other surgeon. It's fine, just write to the other surgeon or the clinic or whatever, and they should give it to you without a problem. Just like I would give you your operation note if you wanted it. Has it gone dark? Is that me? Hi, Angela. Nice to see you. Good to have you here today. So you need to know the way, because when you make that stalk, when you make that pedicle, you can make it in different ways. You can make it based at the top. It's called a superior pedicle. Based on the bottom, it's called an inferior pedicle. Laterally, you can have it bipedicle. You can have it laterally both sides or horizontally both sides. Supromedial. You can have all different types of pedicle. And the surgeon who does the surgery again has to use the same pedicle. Because if you have the nipple based on a superior pedicle, if you've got it attached at the top, and then another surgeon says, I'm going to do another breast reduction and I'm going to attach it at the bottom, well, then you've just cut that pedicle, and the pedicle is based on scar tissue, which is bad, and which is high risk of nipple dying. So the risks are increased when you have a revision breast reduction, when you have a second time breast reduction, because there's a scar all over the place, and you have to make sure you use the same pedicle. But it is possible to do, but it's something that you need to do carefully, and you need to try and make sure you have as much information as possible. And then the third point 3, I want to make on this question, which is just demonstrates what a great question it is be careful what you wish for. I always say to people before they have breast reduction, what size do you want to be? And they say, I want to be this or that, whatever. And I always say, I can't guarantee it, because I ask for size because we always go on size. But what I'm trying to do, and what we're often trying to do when we're doing a breast reduction, is trying to make the shape right. You've got to make it like a pyramid. The nipple's got to be at the apex of the pyramid. You've got to make the width right. You've got to make it proportionate to your frame. Often people who require a breast reduction, their breasts are not in proportion with their body. They're not in proportion with their frame. And so that's what you're trying to do when you do a breast reduction. Sometimes people, when they say, I want to be a B cup or something like that, they don't realize what a B cup will be in them. And it might be that might be a bit small. It might lack projection. It might be a bit flat. You don't want them to be flat because the nipple, like pancakes and nipple there. It doesn't look good. You need to have some projection there. And if you've got a certain width to your chest, you need a certain width to your breast. Nice shape. Shape's important, I believe. So you want a nice shape. I know people say, oh, back pain, all that, but obviously you're going to reduce the volume, make them more in keeping with your frame. But really, the shape is really, I think, is important when you do a breast reduction, and that again will be a reason to have it a certain size. Am I looking scruffy or am I looking okay? I'm going to check myself in the camera. Perhaps I should have done that before I came on air. Anyway, So that was a trident answer on that one, triumvirate answer. So what we've got now is got this question here. This is a patient who is from Belfast who wants to have a tummy tuck and is inquiring because she wants to have a Skype consultation and is an inquiry along those lines. So I think the main inquiry is, do we do a Skype consultation? So the answer to that is yes, we do Skype consultations. We treat them and we charge them the same as a normal consultation because we just put them in the diary like a normal consultation. And also but we encourage you to come for a live consultation in person prior to having surgery. And that would not be charged because you'd already paid, because you only ever pay for the first consultation. So, so yes, we do Skype consultations, but I always say to people who are in this country, or at least who are, who live local to here, to Birmingham, have surgery local to here, have surgery local to Birmingham. There's lots of good places to have surgery in Birmingham and the West Midlands, and you shouldn't have to travel to go to Manchester or London or wherever. You shouldn't have to travel to find a good surgeon, and it's good to go locally for lots of reasons. One with regards to this sort of thing, the consultation, the follow-up, the aftercare. If you've got any little niggles or scars not quite right, it's just so much easier if the surgeon's down the road. If you do need a little bit of revision, dog ear, a little bump lump, need a small revision, it's just so much easier if you don't have to go all the way to some faraway place. And all these things obviously are compounded for if you go abroad, which is another story in itself. So I always say to people, look, have surgery close to home. So that works both ways. So if someone inquires from Belfast, say, look, there's loads of good surgeons in Belfast. Look at the BARPS register, BAAPS, the Plastic Surgery Association, or British Association of Aesthetic Plastic Surgeons, or BAPRAS, British Association of Plastic Reconstructive and Aesthetic Surgeons. They got registers of their surgeons, and you should be able to find a surgeon close to where you live, a fully trained plastic surgeon. Another dig there, not dig. Have I got my books? Yeah, I've written a book about that. Never Accept a Lift from Strangers, currently free on the Kindle store. So if you go to Kindle store and go to Never Accept a Lift from Strangers, you can get my book free on the Kindle until Tuesday the 7th. No. Oh. Tuesday the 7th. That's today. Oh God, is it till, or is it next Tuesday? It's free for a week. My God, is it just till today? Oh well, I'm not sure if it is free. Oh God, right. Oh well. Anyway, you might be still free. It was free for a week. 7th of August. That's awkward. Anyway, that's today. So anyway, so yes. So you must look for a fully trained plastic surgeon. Again, another question there. But look for a fully trained plastic surgeon. But you'll have lots near where you live, and I would encourage you to go near where you live. So if you're in Belfast, by all means, we'll do a Skype interview, a consultation. You can come to the clinic. You can have surgery, and I do surgery on people who live far away. Oh, look at that. We've got some questions coming in. We do surgery on people who live far away, but I always say them this. I say this to them. Say them this. God, can we edit that? Angela, you're absolutely spot on. I agree with you. The price does sway a lot of people to go abroad. Yes, it does. And I understand completely because I've seen the prices of surgery when you go abroad, and it is a lot cheaper than this country. And so I can totally understand why people do it. And it will continue to be a big business, to be honest with you, because the prices will continue to be less than this country, and people will always go abroad for surgery. And the good thing about a lot of the cosmetic operations is they have got a relatively low complication rate. So a lot of people will be fine, and so they'll be fine. And so for a lot of people, it's okay. The problem comes if you have a problem. That's the problem. And there's a small minority of people who get problems, and I've seen big problems and I've seen small problems, and it's just a bit frustrating. If I've seen quite a few people who've had like small problems. They've not been, to be honest with you, they've not been that bad. The problems they've had, bit of wound breakdown, maybe superficial infections, maybe some asymmetries. Things aren't quite right, but it really needs to be the surgeon sorting this out, and the surgeons in can't remember where they've been now, Dominican Republic or Prague or Cuba or wherever, and that's the problem. But and you've also got to ask yourself, why is it so much cheaper abroad? Is it because we're all greedy and making loads of money? Well, I shouldn't have said that, because that's probably what you think it is, but it's not. It's because we have huge amount of money that we have. The hospitals have to spend a huge amount of money on the regulations to make sure the standards in the hospitals are as high as they can possibly be. We have to spend a huge amount of money on indemnity. Another reason why plastic surgeons are penalized in a way, because we spend a lot more on indemnity than non-plastic surgeons. We are covered for £5-10 million. So you've got that cover. We have insurance, which then covers you if you have a problem. But that costs many, many thousands of pounds. And other non-trained doctors, people abroad, have the surgeons abroad got that cover? I don't know. You'd have to check. But that it may not be that they've got the cover. That might be a reason why it's cheaper. It might be that the hospital hasn't got such stringent criteria they have to follow and meet, guidelines they have to meet in terms of their clinical governance and all the sort of running of the facilities. So the problem that is, and one of the issues I make in the book, is not that going abroad for surgery is bad, or at least not that surgeons abroad are bad, because obviously there's lots of good surgeons in every country, just like there's good surgeons in Birmingham, there's good surgeons in Belfast. If you live in Belfast, you're probably better off with a Belfast one. You can come to the Birmingham one, but there's lots of good surgeons everywhere. The problem with the ones abroad is you don't know the level of qualifications, you don't know the level of training, because it's different in every country, and you don't know what the qualifications are, what the training are, what the governing bodies are, who you can go to if you have a problem, because they'll be governed by that country. You can't go to the GMC, you can't go to the General Medical Council or BARPS or BAPRAS, the Plastic Surgery Associations here, and complain about a surgeon over there. You can only complain about surgeons who are members of those associations. So yeah, I'm totally with you. I'm not. Yeah, Angela, you're absolutely right. You're absolutely right. People, does make sense to people go local, but I understand why people do go abroad. So yeah, you can come to see me from Belfast. Please do. Well, if you want to, you can, and I'll be very happy to see if I can help, and I'll do a Skype consultation. But my advice would be, if you're having something like a tummy tuck, which is quite a big operation, there'll be lots of good plastic surgeons in Belfast. So I would advise you to probably have a look at those first. And if you get no luck or whatever, if you want any advice from me, then or anyone else at the clinic, you can always get in touch with us. We'd be very happy to help you. So Ruth is straight in there with a oh, Ruth, that is similar. That's similar to my question here. I've got a question here. So Ruth has said, how soon can you have the implants removed and replaced with big ones after your first breast surgery? Which ties in with my third question, question number 3, having very large breast implants. So Ruth, you're a legend for asking me a question. Thank you very much for that, and I shall endeavour to answer that. Bit of a worry question, that one, Ruth. How soon can you have the implants removed? There's a few issues going on there. So from a purely surgical point of view, when you do surgery, there's obviously a lot of scar tissue, and you want to wait for that scar tissue to settle before you do another operation. Ideally, now, if you need another operation, if you have a hematoma or have an infection or something, you can do surgery at any time. You can do surgery next day, next week, after an operation. You can do surgery at any time. But if you're doing an elective operation, so if you're planning the next surgery for the best time, from a purely surgical point of view, at least 3 months. 3 months minimum, ideally a year. So I guess any time between those two, in terms of scar tissue settling and softening and the surgery being easier. Surgery is very difficult if you go in soon. It's all scarred and hard, and the surgery is not very nice to do, and everything's quite woody, and tissues don't give so much, particularly if you're going for bigger implants. So probably 6 to 12 months, I would say, would be the sort of time that would be the minimum from a surgical point of view. The next point I would make is that I wouldn't make any rash decisions. Sometimes people, when they first have surgery, I don't know if you've just had surgery, I don't know what your situation is, Ruth. I don't know how long after surgery you are or whatever. But if you haven't long had surgery, then I would say to you, does this look scruffy? If I do it up, would it look weird? Yeah, that would look weird. Then I would say to you, if you haven't, live with them for a while. When people have implants, they often think, oh, they're too big, they're too small. They're not right, too high, too low, too wide, too close together. So there's all sorts of issues and things that you go through when you first have surgery. I would say live with them for a while, for as long as you possibly can. You want to minimize the amount of operations you have to your breast. So, I would just be absolutely sure if that's what you want, because again, I don't know what the process was you went through for choosing the implants, but if you've gone through the process, if you've chosen the implants for a reason, I always think, look, you've chosen those implants for a reason. You've hopefully got the dimensions right, got it all nailed down, so it's just the right dimensions, the right width, the right profile. So then you go changing them. Now, I understand you say you want to be big. A lot of people say they want to be bigger, but you've got to be a bit careful that you don't go for maybe a higher profile implant that looks different and doesn't look quite so good, or you go for a wider implant that maybe gives you some problems with being too wide for your frame. So you can have issues when you change implants purely based on size, because it won't just be the size that'll change, it'll be the shape that'll change as well in some way. They'll either go wider or they'll go fuller. So you might be happy with that, you might not want them wider or fuller, but in which case fine. But it's something to think about. If you have got implants, I would say you leave it as long as possible, just for the sort of psychological things to sort of sink in, and to be sure that that's what you really want, because you really need to try and minimize your operations you have to your breast. And just to tie that one in with this, having very large breast implants, this is someone who's been in touch who has already got large breast implants and wants larger breast implants. They're over 1,000 cc's. I can't remember what the word now, but 1,000 and something. Now that's a big breast implant. And really, for me personally, it is, Ruth, you are totally welcome. And I want to say thank you, Ruth, for asking a question on the live. I always appreciate that. I can't like on this thing, but I always go back and like, so I will like you. So I do like you. Thank you for that, Ruth. Kind. So Ruth, this is following in on your one. This is asking about very large. So what I would advise someone having very large breast implants, I personally can't make them look good, to be honest with you. I don't, it's not for me really, these very large, like when you get to over 1,000 cc's, I think it's very hard to make that look good. Long term you get problems with the weight of the implant, stretches the skin, causes problems for the future. And like I was saying before, when you get into like over 1,000 cc's, then you're getting into a bespoke implant, so you're getting a custom made implant, I would imagine. Don't think any implant manufacturers, well, Polytech might make them sort of that size, but yeah, but not much more than that. So, but when you get into this sort of realms, you get into bespoke made. So, as I say, as you get bigger, you either go wider or you go fuller. And I understand some people, maybe for their job or for their work, their bigger implants means more work, and it's important for them. So I understand that there is a need for this sort of look and the sort of this sort of thing, but it's not really the forte of the clinic. I think you got to decide where your strengths are, and I think the strengths and the sort of forte of what we do at the clinic is more for people who've lost volume, people who have maybe always been small or asymmetrical, who want to restore volume back and want to have something that's a bit more in proportion with their frame, because they feel out of proportion with their frame, or the shape's not right. This is a sort of patient for these really big implants. There are some people who use these big implants, and it's not us, because I think in my hands anyway, they do cause problems for the future. So what I would say to you, like I say to everybody, is about do your research, look for someone who does this sort of thing, maybe can show you some results of that they've done this sort of thing, and you feel comfortable with them and they feel comfortable that they can help you, and that's the sort of surgeon you want to be looking for. I'm sorry it's not me, and I'm sorry I can't help you, but that's the sort of surgeon you want to be looking for, someone who is comfortable with using these sort of volume implants, and do your research, shop around, and if you don't feel that surgeon's gelling with you, then choose another one. I mean, I spoke to a patient the other day who said they'd been seeing lots of surgeons and all that, and I think it's good that she told me that. A lot of people don't, they feel, and I understand, they feel anxious about it. I think I'd feel anxious if I was going to see someone. I wouldn't necessarily tell them, to be honest. I don't think I'd tell them. I'd seen loads of others, but I understand that people do see loads of other surgeons, and I think it's good to see loads of other surgeons. We all know, that people see lots of surgeons, and I think it's good to get different opinions. Gina, I don't know I don't know where Katie Price is at the moment with her breast implants, but they do cause, these people who obviously she's had them to for her career and things, and they've done well for that. And so you could argue there's a reason for having sort of implants that may be a little bit out of proportion, but they do cause problems in the long term. So that is something to consider if you are considering having larger implants, and then hopefully the person who does them would be able to counsel you about that. But yeah, so I think it's all about showing finding a surgeon who gels with you and you gel with them, can give you the results you want. And it's absolutely fine to see several, because we all have our strengths and our weaknesses, and the trick is for the surgeon to know what their strengths and weaknesses are, and to communicate that to the patients, because we're trying to give happy patients and good results, or at least that's what we're trying to do here. Oh, Sarah, there you go, she's admitted it. Sarah, how dare you? You'd seen other surgeons before you came to see me. No, it's good. Yeah, absolutely. And I think to be honest, a lot of people come to see other people before they see us and see me, and I welcome that. And if they choose one of the others, then that's fine, because we all get on with different people, and and I think if your surgeon is not happy, or you get the impression they don't want you to see other surgeons, or they trying to sort of make you have surgery there and then, or talk about surgery there and then, I think you got to worry. You got to let people go, have a think about it, and then make a decision in their own time. And then if they come back, then fine, and if they don't, then maybe it wasn't right. That's my view. Sarah, that's a definite double like on that one. If you could double like, I don't think you can double like, can you? Well, I'm all out. How was that? Was that helpful? Was that a quick one? That's it. I'm all out of questions. That was 3. I've done them, haven't I? Yeah, done all 3. I need a haircut before you tell me. Oh, look at that. Sarah felt pressured by other clinics. That's a bad situation. I mean, for surgery, you do not want to be feeling pressured, do you? I hope. I mean, I make it clear to everyone at my place. We're the opposite. We try and say, look, you know what? Because sometimes people say, I want to pay and all that sort of stuff. If I think about it, if it's right, it's going to be right tomorrow morning and things. Yeah, no, being pressured isn't good, and that is bad practice. It's bad medicine. You need to have a think about it. You need to know about the pros and cons. So, yeah, but that is bad if anyone's pressuring anyone else. Sorry to hear that, Sarah, and you're better off out. Come with the non-pressurized people. That's us. Right, we're the non-pressure kids, I hope. That's the idea. Right then. So I'm going to go and have a haircut immediately. And I'm going to call time on this meeting. And if anyone's got a question and is typing it as we speak, I'm sorry, I mean, I will answer it if it comes, but you know, if that happens and if I've missed anything, I will answer it, and then I'll pick it up next week. Actually, there was one. Was there one last week I was going to answer this week? Have a good evening. You too, Sarah. Have a lovely evening. Or did I do that last week? Anyway, I'll go and check. Thank you all for listening. And I'm going to end this broadcast by pressing this button right here. The button has been pressed. And so I'm assuming, oh, it's giving me another button.